Good morning, and thank you all for coming today. As Dr. Goodhue pointed out, it has been an incredible year for OAO. Today, on behalf of our board of directors, I will share a communications and marketing update, an area in which we've been very busy, and celebrate major achievements that contribute to our success in 2015. And while we look back, I'll also discuss what the future holds. To recap, our three key areas of focus for 2015 were member communications, the IC iLearn program, and public education, which was anchored by our 20-Second Daydreams campaign, which focused on the negative effects of computer vision syndrome. On the member communications front, we're still very active on LinkedIn as a way to connect our members across the province. Moderated by OAO policy consultants, Dr. Angela Yoon and Christopher Nickel, our closed group is a vibrant forum for you to share news, ask questions, and to connect with one another. I encourage you to all participate and join the discussions taking place amongst our colleagues. Throughout the last year, Dr. Goodhue's President's Report remained very popular. As most of you know, this communications showcases the good work of our members. Behind me, you'll see some of the members that we featured in the spotlight this past year. This initiative will continue to evolve, so stay tuned for additional updates. Turning our focus to Zoomer Radio, our weekly call-in show with Dr. Ritesh Patel has enjoyed a terrific one-year run. The segment focused on a wide range of eye and vision health topics, and listeners who tuned in were very engaged. At this time, we do feel that this opportunity and investment has run its course, and we have decided to no longer participate as of May 2016. With that said, I'd like to extend a huge thank you to Dr. Patel and to all our members that contributed to the success of this initiative. On to the IC iLearn program. This program continues to grow at a rapid rate, and we've made large strides in the past 12 months, expanding to nearly 700 practices throughout the province. Recently, we launched an impactful and exciting social media-led advertising push in January and again in March to further educate Ontarians about the program and to encourage them to book an IC iLearn visit. Let's take a minute to listen to a radio spot from last year's Back to School campaign that played on stations across the province.
3, 2, 1, ready or not, here I come. But like most kids in Ontario, I've never had an eye exam. And I'm too young to know that not seeing 3 feet in front of me is something that can be fixed. So here I come, hopefully.
Comprehensive eye exams can tell you things your child can't. The IC iLearn program allows children entering junior kindergarten to receive an OHIP-covered eye exam, and if required, a free pair of glasses. Ask your local optometrist about the IC iLearn program.
This, and in combination with other IC iLearn efforts, has contributed to more than 12 million media impressions across the province and more than 800,000 YouTube views of our public service announcement video. The board is pleased to announce that this very important program, now province-wide, will continue beyond 2016. From IC iLearn, we'll move on to a look at our national public education campaign that OAO continues to support. The national campaign is designed to promote and educate consumers about eye health by reaching Canadians through media relations and through a multi-channel approach. The campaign also produces a number of collateral materials that OAO and its members leverage throughout the year. In 2015, the campaign saw continued success, particularly here in Ontario. There were over 63,000 total visits to the national doc page from people living in the province, and more than 6,000 used the Find a Doctor locator tool. As we look ahead to the program this year, we're eager to build on last year's momentum, focusing on 2 key months, May and October. Coming soon during May's Vision Health Month, we will explain the connection that eye health has to overall health through a campaign entitled It's All Connected. We are very excited to share some creative assets which have been developed for May's Vision Health campaign, and we'll be pleased to show them here on the screen. In October, for Children's Vision Month, we'll promote the importance of eye health for children. For both campaigns, you'll see paid advertising in print, on television, and online, media stories, patient and doctor stories, more Ask a Doctor videos, and additional creative collateral which you can all leverage in your own practices. It's been a very big year for OAO-led communications with placements in a number of major publications. For instance, we had 4 Huffington Post blogs written by Dr. Jeff Goodhue, which covered topics on digital screen use, children's vision, the dangers of cosmetic contact lenses, and the importance of using eye health benefits before they run out. This led to 1.2 million impressions and continues to position optometrists as thought leaders and eye health experts. Overall, our media relations initiatives continue to make a big impact. With 28 earned media stories, we secured over 10 million media impressions in publications across the province as we continue to promote Ontario's optometrists as the go-to eye health experts. One of the biggest success stories we had in 2015 was the launch of our 20-Second Daydreams campaign. With this campaign, we set out to position optometrists as the eye health experts by raising awareness of computer vision syndrome through a comprehensive, multi-platform effort. We exceeded expectations with the amazing results you see here on screen. Best of all, 36,000 Ontarians found an optometrist using the OAO's Find a Doctor locator. This was an innovative campaign developed in partnership with Edelman, and as testament to the results of the campaign, I'm very pleased to share the news that it was recently recognized with a gold award in the marketing and PR category from the Canadian Public Relations Society of Toronto. Further, it was handpicked by industry leaders and shortlisted for Campaign of the Year, the highest honor for a PR campaign in Toronto. We'll find out soon if we've won, and we'll be sure to keep you updated. Obviously, earned impressions, clicks to our website, and respected awards are wonderful. But what does this all mean for you? It means that we are able to share a message to a broader audience and help Ontarians find an optometrist in their community. It's how we continue to make a large impression on the public, our stakeholders, and government. A campaign like this would not have been possible without your membership and your support. Which leads me to reveal this year's public education campaign, building on the foundation that we laid with 20-Second Daydreams. We will continue our push to educate Ontarians and to connect them with their local optometrists. This year, we'll introduce our new campaign, Working Hard, which continues to focus on digital eye strain. It's a topic that the public is keen to learn more about. We've taken a very close look at the frequency and perils of digital eye strain, a product of viewing mobile devices, computers, and other screens for long periods of time. With devices everywhere and digital eye strain on the rise, it's more important than ever to go for an eye exam. And we're going to get Ontarians to do just that with Working Hard. The campaign will colorfully illustrate surprising facts around how digital screen time takes a toll on your eyes. In 3 animated shorts, we will illustrate 3 surprising ways that digital eye strain forces your eyes to work harder than they have to. This will be achieved by fictionalizing the world of the inner eye with a recurring animated character named Rod that finds himself living a more beleaguered life because of his humans' less than ideal screen habits. The Working Hard campaign will launch in June. Right now, we're in the development phase, but let me introduce you to Rod, the star of our fictional animated series. As you can see, we're poised for another impactful initiative in the coming months. As always, we will share updates as they become available. And that concludes our communications and marketing update. But before I wrap up, I want to thank you. Your support and investment is key to our ability to make a meaningful impact and to take the conversation to a broader audience. We did it with media relations. We did it with innovative marketing initiatives. We did it with 20-second daydreams. And we're going to do it again with Working Hard. This is money well spent, and we value your input and your support.
Thank you very much, Jeff and everybody, the Council of the OAO, for inviting CAO to come and present some of the activities that we've been carrying on your behalf. I'm going to try and make this fairly quick. I know that we're cutting a little bit of time. So good morning. Thank you for this opportunity. We can go on to slide 2. Who's changing the slides? Oh, good. Does that just happen automatically? All right, perfect. So following our strategic plan in 2015, we worked to improve our engagement with members, partners, government, and the public. We also delivered a collaborative guidelines on age-related macular degeneration, practice tips, and much more to members through the CJO. And a little plug for the CJO, I think it's much better. We've had some acclamations from Thomas and Melton and Thomas in the U.S. about the dry eye issue. They actually reference it in a number of their sort of things as that these little inserts that we've been putting in the CJO are really a member benefit. So in this quarter, we also released a glaucoma screening tool for family physicians. This was done collaboratively with the COS, the Ophthalmological Society, the Canadian Glaucoma Society, and the College of Family Physicians. We shared information on the effects of smoking on the eyes, AMD, nutrition for your eyes, and with the public. We also reached out to 4 federal government committees asking for better, more investment in eye health for Canadians, and that is a big push for our lobbying days up on Ottawa, that Ottawa needs to take vision care more critically than it has in the past. And we ended up the quarter by participating in the launch of an all-party seniors caucus. And if any of you have a chance, go to www.demand-a-plan. That's part of the CMA movement that the federal government pay more attention to seniors. And we've been right along with them, and that got us invited to their annual meeting. Slide 3, yes. Second quarter saw us CAO Council up in Parliament Hill meeting with members of Parliament and celebrating the first recipient of the CAO Vision Champion Award, and that was Pat Davidson. You see her down in the corner there. She was the MP that introduced Bill C-313 on cosmetic contact lenses. We were also joined there with the CNIB, the COS, and the Opticians Association for these celebrations, and we had a little bit of a soiree with the MPs up there. Later in the quarter, we gave members a supplement on cataracts with the help of Alcon, just in time to promote Cataract Awareness Month in June. The quarter closed with us celebrating the Canadian Optometry at Congress in Fredericton, and hopefully some of you had a chance to be there. We also saw Bill C-313 finally put into law, and it will come into total effect this July. Then it'll be dependent on each province to make sure that it's enforced. Slide 4. Third quarter, I made the first official stop as new president at the annual General Council meeting, the CMA, and that was again because of our support of Demand-a-Plan and a number of the other lobbying activities. And this is the first time that we've been invited in this invitation-only activity. CAO made improvements to this Canadian Certified Optometric Assistance Program that led to a 15% increase in participation rates. And we launched a new sub-site for optometric assistance and extended the Assistance View newsletter to all OAs. Our members received legal tips, new case studies, and an update on incident reporting. Next slide. The final quarter of last year brought the introduction of a new communications vehicle between CAO and optometric leaders called the Oracle. And it Some say it went well, some say it didn't, but most of you won't be aware of it because it just goes to the councils. For our members, we provided a new offering, My Opto Site, and it was created with the object of helping ODs create a professional and easy to understand website. So if you haven't looked at that, please go on the website and take a peek at it if you need one. And we also reintroduced the President's Podium. And I'm happy to say that we've got a lot of feedback from it from a lot of members across the nation, and it's allowing us to get a better understanding of what everybody's going through. We also improved our support to student members. Over December, we put the final touches on our student program, which includes business cards for the student members, a joint application form to seek chaos, and a student member website. We welcomed new and returning MPs to Ottawa with a congratulatory card, and it's right in there, I think you see, with diminishing text. So it posed the question, are you having a hard time reading this? And it answered, yes, so do many Canadians, and invited a discussion on what we could do about it together. And we met with COS. Dr. Noel was there, and it was to explore our future partnership opportunities. We actually came with a couple of groundbreaking agreements, I think, about agreeing about definitions of each other and agreeing on time limits for the expiration of prescriptions. And also we created a subcommittee to come up with a joint proposal of not only optometry but ophthalmology, the family physicians and the pediatricians of this country on how frequently you should get your eyes examined. So look forward to that. We were hoping to have that rolling out by the end of next year, but it'll probably be a little longer. Looks like it's going to be a bigger job than we thought, but we're moving along with that. So slide 6, new year, nothing slowed down. We are gearing up for another lobby day that will happen here in early May, where we'll be raising the awareness around critical role of optometrists in the health of Canadians. We're trying to promote a vision caucus. We're trying to promote a chair of vision care within the Department of Health nationally, and we're getting some traction on that. We're also looking forward to perhaps the federal government promoting vision awareness among this nation and putting some of
I'd like to say
all
thank
of
you
our
for
tax
everyone for
dollars
coming
back.
so early this morning on Friday. I'd like to thank also the OAO and Jeff and Jeffrey for inviting me and giving us the opportunity for the college to present to you today. It'll be short because we don't have a lot of time today. First of all, it's been 2 years since the Ontario government passed a new professional misconduct regulation into force. We're all relieved to see that separate doorways, that you could hire opticians now or work with opticians. So these are all positive changes. The college believes that the independent contractor provisions that are also in those regulations are in the best public interest. And a lot of us fought very hard for these. Past President John Mastronardi for one, Richard Najda for past college president, Dennis Ruskin also, to name a few. So it's an elegant way, these independent contractor provision, it's an elegant way for us to keep the optometrists in control of their practice and to eliminate undue influence when practicing with someone else than an optometrist or a physician. So these provisions put the responsibility to maintain independence squarely on the shoulders of the optometrists or members. Every optometrist who engaged in a practice with another entity than an optometrist or a physician, for example, if you're working for LensCrafter, Costco, not Shoppers yet, but the Loblaws, etc., you must have an independent contractor agreement that is in compliance with the regulations. That means that the optometrist must own his or her own records, set and collect their fees, pay rent, not token rent, but reasonable rent, for space and equipment, for their phones, their staff, among other things. If anything is being provided to the optometrist for free, it would be considered a benefit, and the optometrist is practicing in a conflict of interest. Rent cannot be tied to volume of patients or number of prescriptions written. It must be a fixed amount per month and not based on whether or not any patients are examined. The college can investigate a member's practice, including asking a member to provide not only a copy of their written agreement, but to provide evidence that the member is acting in accordance with the agreement. That could be bank statements, etc. We have a great regulation, and now that ensures that optometry remains an independent profession. For example, in England, 80% of optometrists now work for corporations. So because we have this great independent contractor we need to make sure that we are compliant with it. We're still hearing also that from the public that optometrists aren't giving them a copy of their prescription. I'd just like to give you a friendly reminder that it's mandatory to give the prescription to the patient directly, because it is going to complaints, so please avoid that. Now, more exciting stuff. I'd like to talk about our drug regulations. It's been over 5 years now that Ontario has received the authority to prescribe drugs for their patients. As we all know, there's a problem with the drug list. We were the first one to have orals in the country, but moving forward, we like to look at something more interesting, which is Schedule I drugs, which means that any new medication approved by Health Canada that is, according to our college, meets the standards of our profession, we would be able to prescribe. We have circulated that proposal. We have met with several stakeholders. We also met with the government last week to discuss that. So that will be something that we will be moving forward, and hopefully this year. In the interim, though, we still have a proposal of 7 new drugs that we passed in May of 2013, and we are waiting for the government to approve this list, and hopefully in the next month or so. But last year, the Minister of Health promised us that, and we're still waiting for it. So we're hoping, keeping our fingers crossed. On a special note, I just want to say thank you. There's a member at large who always comes to all our council meetings, takes away time from their office, and they do it on their own time at council meetings, and that person is actually Dr. Angela Yoon. And I just want to say thank you for your dedication, because it's always impressive to see people coming to our council meetings. They're open to the public, so I invite you to come to the council meetings, also to participate at the college. So thank you, the OAO, for everything. Cheers.